All right, good afternoon. We are going to shop Medicare supplement plans and prescription drug plans. Once you have all the required information in, such as date of birth, address, male, female, and effective date, you can come to the quote screen here and shop your plans. I always like to start with just Plan G as in George. It is the most popular plan. And it's important to remember that all Plan Gs are the same except for the price and how that price goes up over time. They all go up over time. The national average is usually around 5 to 8% a year. Okay. So the lower they start, the better they finish. So once you shop plans here, it's going to list them all out in order by premium. I like to take out the non-contracted ones to see what we got. So for this person in Missouri, the lowest premium is the United Healthcare Insurance Company at $176.10. And then Cigna, Manhattan Life, United Healthcare Insurance Company of America, Medico, and on. When people ask, is there a benefit of paying more for a plan? Generally not. Only a couple carriers add any additional benefits, like the gym membership, the main one being United Healthcare. Not on the United Healthcare of America ones. It's the AARP branded supplement plans. They come with a lot of the essential extras, like gym memberships and a dental and vision discount. So for this client, I would recommend the United Healthcare plan at $176.10. They will pair that with their prescription drug plan. So since we got some prescriptions in here, we're going to go to the prescription drug plan tab. And we're always going to want to look at partial year cost. So I like to sort by partial year cost. The main reason why you want to do partial year cost instead of a total year cost is if somebody comes into the plan at the very end of the year, a lot of times it may be worthwhile to pay more in premium to bring down their actual drug cost versus paying a little premium and having a $500 deductible to meet, which makes their total out of pocket much more expensive. So for this client, who we've got atorvastatin, Ozempic solution, and lisinopril, all pretty common things anymore, let's take a look. So if you click the prescription button here, it's going to bring up your drugs that you have entered, what tier they're on, are they covered, and any restrictions such as prior authorization, quantity limits, or step therapies. And then you can see the cost by month. Again, this is why it's so important to look at partial year cost to the end of the year. So for this client, they're going to pay $0 for the lisinopril, $0 for the atorvastatin, and only $11 because Ozempic's a tier 6 specialty drug on this plan until they hit the coverage gap or donut hole, which for them is not going to happen because they're not going to be in the plan long enough for the year, which makes their cost much less than if they were to go with a plan that says like $11 premium, where they're going to be paying into a $500 deductible the very first month and then $11. Also, don't forget about programs like GoodRx, Mark Cuban's Pharmacy, and others.